everyone. My name is Kelly Pritchett, and I am a professor in nutrition and exercise science at Central Washington University. I'm also the director of sports nutrition for CW Athletics, as well as the director for the Washington State Dairy Fellowship.
And I am Leah Dambacher. I am a registered dietitian. I work in eating disorders, and I also am a sports nutrition fellow through the Washington Dairy Council.
And today we're going to discuss how to optimize energy availability in sport. And we'll discuss what this concept is and how you can help your athletes optimize energy availability. And so we'll discuss this concept of energy availability. Although difficult to measure, we'll discuss some ways that you can determine if you might have an athlete who's at risk for low energy availability, what some of those contributing factors may be, this newer concept known as relative energy deficiency in sport, and some of the health and physiological outcomes. And then finally, we'll get into optimal nutrition to support your athletes. And so this concept of energy availability describes a situation where we look at energy intake, or the calories consumed, and exercise energy expenditure divided by the athlete's mass in kilograms, or their fat-free mass in kilograms. And so why this is so important: for example, if you look at an athlete who's consuming 2,000 calories and they're expending 1,000 calories through exercise, they only have 1,000 calories left over to support normal health and physiological functioning. So this becomes important. We start to see things like amenorrhea, or a lack of menstrual cycle, as a result in some of our female athletes, and we'll talk about other common signs and symptoms later on. And so these are just a few examples. So if you see the first bar shows insufficient energy intake. And so as a result, this athlete is not consuming enough calories to meet their training demands. And so this will put the athlete in a state of low energy availability. So that's one cause of low energy availability in athletes. Another cause, which can be often unintentional, is when an athlete has an excessive training volume or excessive training load, and then they do not have enough energy available to support physiological functioning. And so you can see here in the middle, this is the ideal situation where the athlete is getting adequate energy intake from their diet, as well as their energy demands for training are not too high, putting the athlete in a state of low energy availability. And so, as we said before, oftentimes this can be unintentional, or this may be intentional or inadvertent. And we'll talk about some of these different scenarios. For example, with unintentional, this could be just a lack of knowledge in terms of how much the athlete is actually expending through their exercise. So they could be training in a fasted state first thing in the morning. I see a lot of athletes do this just because they're not hungry, or they do not have the knowledge regarding what their energy needs look like. Intentional, this may come from a state of body weight concerns or aesthetic or performance related concerns. The idea that if I'm lighter, I'm going to be faster, or I have to look like a specific athlete. So this can often lead to disordered eating or restricting patterns. And so adolescent females are notably more susceptible. Their body is going through changes around age 13 or 14. So there may be some resistance to this change. And so it's really important that athletes understand that this change is normal. We do not need to fight it. But it's when the athlete tends to restrict that we see this low energy availability situation. And then we have inadvertent, which can also cross over into the unintentional category, I suppose. This could be a lack of appetite or drive to match energy intake to energy expenditure. I think of a sport like cross country or track tends to blunt the appetite, especially after exercise when it's important to refuel. Could be lack of knowledge. So again, just this idea of how much energy they're expending in relation to energy intake. So a lot of athletes do not have a good idea of what this looks like. It could also be barriers to food access. So food insecurity could be one problem, lack of time. We know that oftentimes athletes will go from school straight to practice. And so with this, it just requires some planning ahead. And so low energy availability in athletes is an area that Leah and I have recently looked at in some of our survey research. And so we found that in a group of collegiate cross-country runners, 55% were at risk for LEA. And this was based off of a survey or risk assessment tool known as the LEAF-Q. We also found that 57% reported menstrual dysfunction and 41% were at risk for disordered eating. So what does this look like in high school athletes? Pretty similar in terms of the numbers. So if you did a search in the literature, you would find pretty consistently we see around 40 to 50% of athletes being at risk for low energy availability as well as disordered eating.
So as we mentioned, disordered eating can be a really large risk factor or consequence of low energy availability. There's a lot of body changes going on around this age in high school, potentially some perceived performance benefits to weighing less or having differing body compositions. And these thoughts might lead to some disordered eating behaviors or some problematic eating behaviors with food. And so oftentimes an athlete during their athletic career might land somewhere along this disordered eating spectrum. So on the very left side, we have optimized nutrition. We are fueling our bodies with enough food to sustain the exercise that we're exerting, and our bodies are able to function normally. We are feeling safe, supported, and we really just have balanced nutrition, and our health is really optimized. And with disordered eating behaviors, we might start to move along this spectrum into some disordered eating patterns. So this might look like restricting, not eating around their peers. You might start to see some of these problematic behaviors pop up in your athletes. And what we want to prevent is these disordered eating patterns becoming a full-blown eating disorder. And this is a state where the individual might need a higher level of care. They might need some treatment to see a dietitian. And so again, we want to keep athletes in the optimized nutrition realm and prevent the path of disordered eating along the spectrum. So there's a lot of reasons why disordered eating is a risk and why restriction is a risk among athletes. This graphic can display several different components of that. So we have the athlete mentality. Oftentimes, athletes at a high level are really high achievers. They are perfectionists. And this is a large risk factor for disordered eating because oftentimes athletes might try to get to that next level any way they can, and this might come out as some disordered eating patterns. We also have outside societal ideas, so body image norms that athletes might see on social media, and then also just the sports environment and culture. We know that sports culture is extremely competitive. There's very high expectations from the athlete themselves, from coaches, from their peers. And so these high expectations, again, might lead an athlete to, engaging in some of these behaviors to, get the body that they think that they need for the sport, or get to the weight that they think that they need, and can really become problematic. We also have the language, or just the culture in sport in general, sometimes might lean towards language such as thinking lighter might mean faster. And that is something that is just not true and can be really, really problematic with athletes of this age. And having the mindset that if I could only lose a certain amount of weight, or if I could have more muscle and less fat, or whatever the thought process might be, to get to that next level, to be faster or to be stronger. That kind of messaging can be very, very problematic, especially in athletes at this age. And so this leads me to talking a little bit about relative energy deficiency in sport. So we talked a little bit about why it's really, really important to sustain an energy availability level that is sufficient for both health and performance. And so relative energy deficiency in sports, or REDS, is an expansion of the female athlete triad. And many of you might have heard of the female athlete triad before. And this is the concept of 3 different things: low energy availability, poor bone health or high frequency of injury, and then amenorrhea, or loss of a menstrual cycle. And these are 3 things that are oftentimes potentially easy to point out in an athlete that does not have adequate energy availability, as their pretty prominent outcomes. And so what the REDS model is an expansion of this model. It includes a lot more information on both health and performance consequences of low energy availability, which we'll talk a little bit more in depth on. And it's also gender inclusive. So the female athlete triad originally, of course, was just looking at females. It has since expanded into the male athlete triad as well. However, research has shown that there's also a larger number of both health and performance consequences that might coincide with low energy availability. And this graphic touches on many of those health consequences that you might see in your athletes if they do not have sufficient energy availability. So we might see some reproductive function. So again, that menstrual dysfunction, or potentially an athlete in their junior or senior year of high school who has not started their period yet, when we know that by that age, it is a normal body function, and that should have happened by then. We might see some changes in their digestion or their gastrointestinal health. We might see differences in their blood markers. It could be low in iron. A multitude of different blood markers might be a red flag for REDS as well. We also might see a decline in their mental health or in their mood. And this model has an arrow going both directions for the mental health component, because we know that disordered eating can be an additional cause of REDS. We might see changes in their growth, and especially at this age. This is where a huge amount of our growth happens, is in high school. Our bone growth, our skeletal muscle, and all of these things can be impacted if we have low energy availability. Cardiovascular health, immunity, neurocognitive, and sleep can also be disrupted with low energy availability, or in this REDS health conceptual model. And so the next part of the model talks about the performance consequences. So of course, health really does come first, and those are all extremely, extremely important things in the athlete's development. And sometimes performance or how well somebody is doing in their sport is the most important to them, especially at this age in high school. So these are some things that we might start to see in athletes that are suffering from REDS. So we might start to see a decrease in endurance performance. Maybe from year to year, we might expect to see progress and we're not able to maintain that. Decreased recovery time, decreased training response, decreased athlete availability. So if we're having a multitude of athletes on a team who are going through these same consequences, then our team is not going to have sufficient athletes. Decreased cognitive performance, slow response times, decreased power performance. That goes along with decreased muscle strength or even the ability to put on muscle. And then decreased motivation as well. And this really coincides with that decrease in mental health that might be a consequence as well.
Okay, so now that we've defined REDS, I'm going to discuss how you can screen your athletes for low energy availability or maybe some red flags to look out for. And so one thing I'd like to mention again is that, an athlete does not have to have disordered eating or an eating disorder to be in low energy availability, but it is a risk factor. And I think this is clearly noted in a lot of the more recent studies that there does tend to be this association, but not all are going to have disordered eating. And so some things that you may see, frequent or reoccurring injuries. We can get really specific with this from a stress fracture incidence, and then also site of stress fracture as well. So if an athlete has had 2 or more stress fractures in the past year, that is a pretty telltale sign that the athlete has low energy availability. And then there's even more site-specific from an injury standpoint. Frequent illness as well. If you have an athlete that's commonly sick, they're not able to get over upper respiratory tract infections, those sort of things, if they're commonly complaining of those. Disordered behavior around food. If you're in a team environment situation, this athlete, may not eat, or they may bring their own food. So it's important to be aware of, some behaviors around food and training. So we mentioned training here as well. So this could be an athlete that's doing more than what's prescribed. And I think this is really hard to kind of differentiate. Do I have an athlete who's highly driven and wants to get the best out of themselves, or are they truly overdoing it? So just important to kind of be careful with that. And be aware that, it could be an attempt to increase energy expenditure versus actually improve performance. And then loss of menstruation, as Leah mentioned, we define a lack of 3 or more consecutive menstrual cycles as amenorrhea, or no period by age 15. So this is referred to as primary amenorrhea. If you have an athlete who started their period, let's say at age 14, and then they lose their cycle when they're 16, we would refer to this as secondary amenorrhea. I also want to mention that, this is not always the culprit. So we could have PCOS as one of the causes, but it really is a red flag and one of the most, I would say, objective things that we could look for. And then also reduce performance. If you have an athlete who's just not seeing the training response, they're not adapting to the training, you have to start asking questions. Is my athlete consuming enough energy? Are they getting adequate energy availability? Some other things not mentioned on here, but they could be, really irritable, hangry, just, moody. And I know it's difficult to maybe differentiate this with a group of high school or middle school athletes is I have a middle schooler and we're going through some fun changes in our attitudes. So, but if it's commonly happening, just assess whether or not they're fueling. And one thing I want to bring up is because I do think that this is still, for whatever reason, a common myth that we may hear from even some doctors to this day. But this idea that your absence of a menstrual cycle is a normal part of training. So an athlete who started their period, they go to the OBGYN, and the doctor may state that, well, this is just because you're doing a high training volume. This is absolutely not true. This is likely a sign that they're under fueling. And so I want to emphasize that your menstrual cycle, or an athlete's menstrual cycle, is a sign of health. And that if they're not having it, again, this could be a sign of low energy availability. And then, as mentioned in the REDS model, it's one of those health outcomes, which has some pretty significant physiological outcomes in the future. If not treated, we start to see low bone mineral density, eventually osteoporosis. So this might be something that we don't see right away. It does take some time. And so it's really important that we correct this right away. I also want to bring up oral contraceptives or birth control, and putting an athlete on birth control to correct this is not correcting the issue, it's masking the issue. So we don't actually know if the athlete is truly getting enough energy or menstruating because they're on this hormonal birth control. And so bottom line, it's important to refer the athlete to a dietitian to restore energy availability, and a physician who's knowledgeable in this area about athlete health. And then, so from a nutrition standpoint, it's very important, first and foremost, that if you suspect that your athlete has low energy availability, to reach out to a sports dietitian who can help with this correction of energy availability. And even more important, if you suspect that there's an eating disorder or disordered eating, that they're referred to both a physician and a sports dietitian. So commonly what's done from an energy intake standpoint is we'll look at increasing the athlete energy intake by about 300 calories per day as a good place to start. And so that may be as simple as like looking at pre and post exercise fueling as a strategy to really optimize their energy intake. And as we've said before, really it's health first approach and performance second with the athlete. Other strategies may be a decrease in training, and this may be the first place that you look if there is, some availability in their training to reduce the volume. Also avoiding overtraining, as I mentioned before. So going back to, the assessment with the athlete. So what is the training for, making sure that it's specific and done carefully. There's an outcome or a goal for each session, and that they're not overdoing it. It's also important to monitor certain blood work. We may look at, for example, iron or a hormonal profile. And then if we do have athletes that are not having a menstrual cycle or have amenorrhea, they may require additional supplementation to support their bone health through calcium-rich foods, but also a vitamin D supplement.
So as we mentioned, some of these external pressures to change the athlete's body, change their weight, can be really problematic and can be a risk factor in developing disordered eating, which can lead to these red symptoms or low energy availability. and the athlete just having really low body dissatisfaction. And of course, this is something that we do want to prevent. So how do we reduce these risks? First would be to promote positive body image. So we know that athletes at this age might be going through quite a bit of body changes, and having the ability to normalize those changes and talk about it in a neutral environment can be really important for athletes around this age. To know that it's normal to go through these changes, and weight will fluctuate and all of those things. So really just promoting a positive environment to talk about that. And the next would be to de-emphasize weight. So as mentioned before, there's a common misconception that, for certain sports, being a certain weight might have performance benefits. And while in some cases that might be true originally, this is not a sustainable practice for improving either their health or their performance. And so taking the emphasis off of weight can be really important in reducing the risk for low energy availability or for disordered eating. And lastly, normalizing regular and adequate fueling for the sport. And so we'll go through some specifics of that next. But really just promoting that your athletes are fueling before, during, and after if needed, that they are getting advice from sports dietitians if needed, and just really promoting that regular fueling around sport in the off season as well. And just really creating a positive environment around fueling for your sport rather than things like restricting or needing to change someone's body. So the goal from a nutrition aspect in optimizing energy availability, how do we get there, is really eating on a regular and consistent pattern. So we can get to a point to optimize these energy levels with athletes who are expending so much energy from their workouts, from all the activities they're doing at school, and just being able to provide the energy and the fuel that they need for those things. And so how can we manage this? As we've mentioned a couple of times, thinking about the before, during, and after can be a really helpful way to think about nutrition to optimize energy availability in athletes. And so before a workout or a practice, we want to make sure that our athletes are prepared for the work ahead. So whether this is a break that they have in between school and practice, if it's before a game, making sure that they do have the energy budget to then go ahead and do that exercise or do that practice that they need to get done. So really making sure that your athletes are prepared for this. So making sure that, all athletes have gone to the pregame meal or they've all had their snack before practice, just, normalizing checking in before to make sure that they're not starting their practice with an empty tank. And the next is the recovery phase. So we want to make sure that our athletes are refueling after their practice or their competition, because their body is now depleted. They've now used all of that energy. So refueling with carbohydrate-rich snacks or meals. This is also a great opportunity to recover and build their muscles and reinforce building their strong bones as well. And then again, for building, really emphasizing frequent small servings of protein throughout the day can be beneficial as well, rather than just emphasizing protein at one meal or another. But again, coming back to that consistent fueling throughout the day. Some more details on nutrition tips for athletes. Here we're talking about the 3 macronutrients that are important for athletes. Number 1 being carbohydrates, and this is the main source of fuel used during exercise. So it's important during all 3 phases, before, during, and after exercise as well. And so this can be a good conversation if you overhear your athletes talking about how, they're trying the newest fad diet and they're cutting out carbs. That is a huge, huge red flag that there needs to be some sort of intervention, because carbohydrates really are the main source of fuel during exercise. Protein, we know, is important for building muscles and reinforcing what the athlete has done in the gym or done during practice. And so this, while important, is not the main source of energy used for exercise, but we do know that it's important for reinforcing and building those muscles. And then lastly, we can talk about fat a little bit. And this is typically the secondary source of fuel that an athlete will use. Very, very important for multitude of reasons. So making sure that the athlete has a really well-balanced diet and making sure that we have all 3 components here. And lastly, talking a little bit more about some micronutrients of concern. These are ones that oftentimes come up for athletes. They may have low iron stores, can be really common, especially in females and athletes that are growing and are super active. So iron is one that might be a concern if your athlete goes to get blood work done. Calcium as well is going to be really important for bone development, muscle contraction. Definitely one that we want to make sure our athletes are getting enough of, as during this age, they're reinforcing their bone mass to have strong bone density for the rest of their lives. And by 18, we typically see that peak bone mass is reached. So we want to make sure that our athletes are getting sufficient calcium. Along with calcium, we know vitamin D is really important for its absorption. Vitamin D is also important for muscle contraction and immune function. So another extremely important one for athletes. Hydration, another one just to point out, very important for all athletes to make sure we're adequately hydrated, both before exercise and then replacing any fluids lost through sweat after exercise. And last, just to point out again, the importance of meal timing and making sure that we're getting adequate fueling prior to exercise. So we're going into our practice or our competition with a full tank. So making sure we have some sort of high carb snack or meal within about an hour of exercise, and then making sure to refuel in that 30 to 60-minute window after exercise. And timing can be really important to make sure that we're replenishing those glycogen stores that have been depleted after exercise.
And so if you want more information for nutrition for your high school athletes, we do have this manual that's available on the Washington State Athletic Association website. There's recipes in this manual, information on supplements, ergogenic aids, and more. And this was also developed by a former Central Washington University student. And for more information, if you're active on social media, follow us on CW Sports Nutrition, where we're commonly, discussing the latest sports nutrition trends and myths. And also, we do have our intake form available on the Instagram website. So if you're interested in a group talk or an individual consult, we can help with this. Thank you so much.